Maybe I should add that 19 years ago I was the one organizing this kind of a meeting in Bonn in Germany for the German Society of Tropical Surgery, which I'm a founding member of. So my background is in surgery, but I have a lot of experience in humanitarian assistance and in development. And I would like to share with you this new approach, or how to apply sterilites. And I have a very, very competent joker with me, which is Martina. She is a nurse and cytobiologist, so all the complicated questions, please refer to her. She's much more competent, and also within the application of sterilites, she has a lot of experience. Okay, so what are we talking about? This is a technology, and it's called electrodiaphragmalysis. And through this technology you can produce sterilites. It was developed from water purification technology, and it's producing so-called electrochemically activated water. This is something like a technical expression for the product. It was further developed and certified for medical application within wound management by Aquis in Germany, and in the EU there is a certification. And sterilites, wound rinsing solutions and wound gels are available in Germany, marketed in Germany since November 2007. The technology can be used to produce two solutions for wound cleaning. This is what we will talk about, but you can also use it as a surface disinfectant. So you can produce a surface disinfectant with the technology, and you can also use it for the production of drinking water, for water purification. The ingredients are relatively simple, so you need demineralized or distilled water and salt, and not in a very high concentration, and you need electricity to produce it. And you need the equipment to do it. What are sterilites? Sterilites are produced from distilled water with a mild concentration of salt via this technological process. There's a diaphragm and there's electricity, as you can see in the sketch. And this leads to a temporary, about 6 to 12 weeks, electrochemical activation. So the water is active, not permanently, but for this period of time. It is quite efficient and effective. Besides reactive oxygen species, the products contain different chlorine compounds and have a high oxidation reduction potential. Sterilites have a very good cell and tissue tolerability, are biocompatible, toxicologically safe, with a very low cytotoxicity. I will not go into detail, but this is just to show you a little bit what comes out of this process, and just to pinpoint, for example, the pH of the anosteralyte solution is relatively low, and I will show you later on. This is probably one of the reasons why the wound healing is so much improving if you apply this kind of water solution on wounds. What are the effects? There's a very effective reduction of germs, and all kinds of germs, you can say. There is a reduction of wound layers, biofilms, necrotic tissue through selective autolytic debridement. The low pH is supporting germ reduction and wound healing, probably by enhanced oxygen supply. There's a recent publication which came out this year, and pinpointing the importance of the pH within the context of wound healing processes. It's also an active conditioning of the wound ground, and it's reducing the interleukin-1 beta, resulting in an interruption of the infection cascade. The physicochemical effects on wound enhances physiological healing in compromised wounds and tissues like diabetes, poor circulation, and burns. Application of sterilites are wound irrigation solutions for cleansing and moisturizing of acute and chronic wounds, and wound dressing, even in problematic cases such as MRSA or Pseudomonas populated wounds. It works. And the solution can be applied for irrigation of natural orifice and mucous membranes. For example, you can do it for the urine bladder irrigation. Besides the decontamination and the cleaning, there is a marked effect on the wound healing process, even of poorly circulated tissues and wounds. And that's why patients with burn wounds, decubitative defects, chronically contaminated wounds, and ulcers, tropical ulcers, or complicated diabetic foot problems benefit from the application of steralytes. Now we would like to share with you a case study, a small one from Swaziland, where Martina has been, and enable that small hospital to produce the steralytes on their own. So there's also a training component involved, and this is the case. It was a 30-year-old lady, and she was suffering since 2 months already from an insect bite, which was infected and developed a huge ulcerating wound. And on the first day, she was then seen, and the treatment started. The bandage was sticking on the wound. There was a typical pseudomonal coloring and cover on the wound. And following that situation, the treatment was like daily dressing with initial cleaning with moistened gauze compress, followed by application of soaked anosteralyte 30% for 10 minutes, cleaning the wound and dressing with anosteralyte 30%, gauze compresses, and then covered with dry compresses, which was fixed then by a bandage. So this is a typical application how you can do it. And it would have been recommended to do it twice a day, but because of staff shortages, so the nurses decided to do it only once per day. On day 2, there was already a marked pain reduction, and the treatment continued for 6 weeks. It was then the foot was then skin grafted, and so these are the photos we would like to share with you. So you see, it was a big wound, and it was cleaned by this kind of application, and then after 6 weeks it was skin grafted, and the last photo is already from June, so 2 months after the skin graft was applied. So this is one indication, one possibility to use it. Here's another case. It was a climbing accident with a luxated left ankle. In fact, that was my left ankle. And because of the luxation, I really had a deep pressure ulcer. And I just tried, let's try anosteralyte. I did it, and I really was wondering how fast the wound was healing. It was really deep, and you know, on the tip of the ankle, it's not a good place for wound healing normally. Yeah? So I was very pleased that it went quite fast. In preparing for this session, and also in other discussions we are on, it is evident at the moment that there is only poor evidence for wound management, and there's still a lot to do. There are only few randomized clinical trials which are for pharmaceutical products are compulsory, but for this kind of wound management products, which are medical products, it is not compulsory. So there's a big problem, which was also recently published in the German medical journal. There's a risk of a lot of eminence-driven or industry-driven concepts instead of evidence-based procedures. So there is a need to further investigate effectiveness and efficiency of wound management, referring to dressings, but also to the antimicrobial effects, yeah, and to find out what is supporting the healing processes. Aquis went on an event. There was a call from WHO for innovative technologies that address global health concerns, and the technology and the steralytes were selected in 2010 and listed in the report of this year as one of those innovative technologies. What are the perspectives? So over the years there are more than 300 case studies which have been documented and analyzed within also the registration and certification processes. The idea, or what we would like to see as a perspective, is what is also our objective, to make sterilites available in hospitals also in developing countries. How can we do that? We need to identify possible partners, hospitals or pharmacies, people who apply the method and the sterilites. And Aquis is prepared to supply sterilites for testing and like to further investigate effectiveness and efficiency of wound management, referring to these 3 points, like addressing what is antimicrobial effect and healing. We from the university in Bonn, we would like to accompany this kind of operational research, so to say, and we are currently also planning to do something like that, not only in developing countries, but also in Germany, in Bonn, and in other places. It is possible to initiate local production, as you could see in the Swaziland case, and we would like to follow up opportunities to use the technology for the production of disinfectants for surface disinfection or instruments. The registration process for that is currently under the way in Germany and also according to the European registration law. Research, so the influence of sterilites on cells of the musculoskeletal system and their activity on germ reduction and biofilms was researched at the University of Marburg in the Department of Medicine and the Center of Orthopedics. The data will be published next year, and the preliminary information, which is quite interesting, I think, is that there is a high biocompatibility of sterilites in lower concentration. It has been shown in vitro, even in cell cultures and osteoblasts and chondrocytes. So you could use it also on cartilage, for example, for rinsing of infected knees, for example. Yeah, what Aquis can offer is a commitment to further research and collaboration with partners in Europe, but also in developing countries. As I already mentioned, the supply of sterilites for testing is an option, but also in further perspectives, to find out whether it makes sense, whether it's maybe also an idea for efficiently supply a hospital in a resource-poor setting with continuous supply of this kind of wound irrigation solutions, but as well as disinfectant in the long run. And so Aquis and we are ready to get in touch with you, and if you have further questions, please. You can ask me now or Martina, and there's also a stand outside the door. Thank you so much.
Thank you.